Have you ever pondered how something as simple as a tiny white pill can trigger an enormous issue? As we bring the screen to life, a single white pill manifests, slowly transforming into a massive, daunting cloud that swallows the whole screen. It's nothing complex, just a painkiller. Yet have you taken a moment to reflect on its journey, how it transfigures into a national catastrophe that echoes throughout every aspect of our lives? The sequence begins subtly, almost imperceptibly. A single prescription at the doctor's office, a pill recommended by a friend to alleviate discomfort. Yet in no time the situation speeds up, spiraling into a silent, lethal epidemic that has been consistently causing harm, hidden in the shadows of the United States. As the dark cloud recedes, a title emerges on the screen. The Opioid Crisis, a convoluted health disaster that has claimed innumerable lives and wreaked havoc on communities, families, public systems, and economies nationwide. This crisis has seeped into every stratum of our society, transforming once bustling neighborhoods into deserted towns, straining our healthcare and criminal justice systems, and leaving a generation of children without parents. The screen then reintroduces the opioids, these potent painkillers initially lauded as a marvel, a universal for those battling chronic pain. But in a wicked turn of events, these medications have transmuted into a monstrous entity of addiction, overdose, and ultimately, death. The magnitude of this crisis is simply overwhelming. Imagine an animated city the size of Miami gradually vanishing, more than 400,000 lives lost to opioid overdose in merely 2 decades, a number exceeding the entire population of New Orleans. Who is the villainous puppet master manipulating this disaster? Exposes a company and its deadly product, OxyContin. This company suffering as an opportunity for exploitation, all under a deceptive veil of relief and recovery. To fully grapple with, we must first immerse ourselves in the past and plot the trajectory of its primary antagonist, Purdue Pharma. Keep an eye out for our forthcoming video where we'll guide you through a thorough investigation into of Purdue Pharma, its deceitful transformation of the medical landscape, and the startling consequences of its actions. Stay tuned as we unravel the unsettling story of corporate greed, manipulation, and the human toll of the opioid crisis. Purdue Pharma, a company that's now heavily associated with a major health scare, began its journey as a humble pharmaceutical organization. This entity was once regarded as a shining example of medical innovation. Established in the late 1950s by the Sackler brothers, Arthur, Mortimer, and Raymond, Purdue Pharma initially gained fame for commonplace items like earwax remover and laxatives. However, it was during the mid-90s that Purdue Pharma came under the limelight. This was when the company unveiled a groundbreaking new medication, OxyContin. Claiming to relieve intense discomfort for up to 12 hours, double the duration of any other drug in the market, OxyContin rapidly became a favorite amongst many. It wasn't just the drug's efficacy that contributed to its fame. Purdue Pharma put forth forceful marketing techniques to establish OxyContin as the primary prescription amongst medical practitioners nationwide. Sales agents were lured with tempting bonuses to promote the drug, and doctors were enticed with all-expenses-paid trips to pain management conferences where OxyContin was extensively advertised. This was a turning point not just for Purdue Pharma but for the entire pharmaceutical sector. In just 4 years, OxyContin sales surged from $48 million in its inaugural year to over $1 billion. By the dawn of the new millennium, OxyContin accounted for more than 80% of Purdue Pharma's earnings. However, OxyContin's success cast a long, grim shadow, one that would soon be brought to light. The forceful promotion and widespread consumption of the drug were fostering an overlooked epidemic of addiction, a dormant catastrophe waiting to burst forth and expose the real price of Purdue Pharma's spectacular ascent. The problem didn't happen all at once, it was a slow progression, and Purdue Pharma was a significant contributor. The dawn of the new millennium witnessed a sharp increase in opioid prescriptions, a trend that Purdue Pharma largely instigated. Pursuing an aggressive marketing campaign for OxyContin, an intense painkiller, was instrumental in this rise. They portrayed an image of a wonder pill for pain, a medication that could provide 12 hours of solace with minimal addiction risk. Yet behind closed doors, Purdue was twisting medical literature to back their assertions. They financed research studies and paid physicians to write articles exaggerating the advantages of opioids and downplaying the dangers. This deceptive information was then propagated to doctors nationwide through a legion of salespeople. Doctors, thinking they were acting in best interest, started prescribing opioids at unparalleled rates. Purdue's deceptive advertising tactics were not just directed at healthcare practitioners. They initiated patient advocacy drives, insinuating that pain was a grossly neglected issue and that opioids were a secure remedy. The firm even developed educational resources for children, subtly inculcating the notion of opioid usage from an early age. Consequently, opioids pervaded communities across the country. Millions were exposed to these potent painkillers, many of whom were ignorant of their addictive properties. The drugs were overprescribed and mishandled, leading to an avalanche of addiction that engulfed the nation. This was not a case of unanticipated repercussions. In-house documents have unveiled that Purdue knew about the addictive nature of OxyContin early on, but elected to conceal this information to guard their profits. Their maneuvers directly led to the escalation in opioid prescriptions and the subsequent surge in addiction and fatalities from overdose. The repercussions were calamitous, resulting in rampant addiction, fatalities from overdose, and a public health calamity. Little did many know, Purdue Pharma was more than just a business selling a product. They were an instigator in an epidemic, a major participant in a crisis that continues to wreck lives and communities till date. And the tale doesn't conclude here. As the problem got worse, Purdue Pharma found itself in trouble with the law. Renowned for creating OxyContin, the company faced a wave of legal action due to its responsibility in the opioid catastrophe. To tackle these lawsuits, Purdue suggested a bankruptcy settlement. This settlement, which was accepted by 43 U.S. states, proposed that the Sackler family, Purdue Pharma's owners, would give up their ownership, donate $4.5 billion to fight the opioid crisis, and sell the company by 2024. This solution, however, was turned down by a federal judge, who had issues with a clause protecting the Sackler family from future lawsuits. This decision was celebrated as a win for the victims of the opioid crisis and the Department of Justice, who argued that the settlement took away the victims' rights to sue the Sacklers. Predictably, Purdue Pharma decided to challenge the decision. But the legal issues for Purdue Pharma don't stop there. Its partnership with consulting powerhouse McKinsey has also been questioned. McKinsey's active role in promoting OxyContin and adding fuel to the opioid disaster resulted in a hefty $574 million settlement with 49 states. This controversy even played a part in McKinsey's CEO, Kevin Snyder, being voted out of a second term by the firm's partners. Politically, the opioid catastrophe has been a heated topic. Consider the Senate race in Nevada, where existing Senator Catherine Cortez Masto blamed Republican rival Adam Laxalt, Nevada's former Attorney General, for not suing opioid manufacturers. However, Laxalt's office, despite strategic disagreements with Reno over litigation tactics against opioid manufacturers, did sue Purdue Pharma, thus making Cortez Masto's claims more complex. Despite these battles, the opioid problem persists, leaving the victims and their families to deal with the aftermath. The opioid crisis serves as a significant reminder of the crucial nature of responsible medication use. This issue, largely influenced by Purdue Pharma and the Sackler family, continues to cause devastating consequences. At present, we are in the midst of a crisis that has not only taken innumerable lives, but also broken numerous families, crippled communities, and stretched our healthcare system to its limits. On the brighter side, we witness resilience. We see officials, healthcare providers, and affected families working in unity, fighting for justice, and aiming to avoid further tragedies. The court's refusal of Purdue Pharma's bankruptcy settlement, seen as a victory for those affected by the opioid crisis, is a testament to this ongoing fight for justice. The story of Purdue Pharma has also triggered wider discussions on corporate responsibility and ethics. It's an evident indication that we are no longer willing to overlook unethical practices, regardless of the corporation's power. Nevertheless, the fight continues. The opioid crisis is a complex problem that needs a multi-layered response. It urges for stricter control of pharmaceutical companies, increased transparency in the healthcare sector, and more available resources for those grappling with addiction. It necessitates prioritizing health over wealth. The lessons we've learned from the Purdue Pharma incident serve as a stark reminder of the human cost of corporate greed. But they also act as a motivating call, a call to action. We should not let these lessons be forgotten. We must remember them and use them to bring about change to ensure that no more lives are lost to the opioid crisis. Knowledge is power. Let's share this video, spread the word, and together we can increase awareness of the opioid crisis, because every life matters. Thank you for watching our video on the opioid crisis, Purdue Pharma's dark legacy. It's a story that underscores the power of corporations, the devastating effects of unethical practices, and the pressing need for change. But remember, change starts with us. And together, we can make a difference. If you found this video informative and impactful, consider subscribing to our channel for more enlightening content. Your subscription not only supports our work, but also contributes to a larger movement of awareness and education. Moreover, we encourage you to share this video with your network. The more people know about the opioid crisis and Purdue Pharma's role in it, the more equipped we are as a society to prevent similar instances from happening in the future. Your support can make a difference in the fight against the opioid crisis. By raising awareness, advocating for change, and standing in solidarity with those affected, we can together address this crisis and work towards a healthier and safer society. Remember, every subscription counts. Every share spreads the word further. Together, we can make a difference. Thank you for your support.